Star, Chautauqua Updates, Shawcat, The Observer, Jamestown Gazette, Jamestown Post-Journal.
Dennis Phillips.
Thank you, Dennis. Spectrum News, WBFO, WDOE.
Dave Raleigh.
Thanks, Dave. Westfield Republican, Channel 2, ICU Channel 12, IVB Buffalo, WJTN Media 1.
Terry Frank, present and accounted.
Thank you, Terry. WKBW Channel 7. Western New York News Now is here with us. WRFA. Okay. If you could, please mute your telephones, and we'll be ready for the question and answer period at the end of the press conference. Just waiting for everyone else. Ready? All right. I'd like to welcome everybody to our press conference for today, Friday, June 12th, 2020. County Executive P.J. Wendell. Joining me to my right is Director of our Office for the Aging, Dr. Marianne Spanos, and to my left is Christine Schuyler, our Public Health Director. Just to recap the week as we have in the past, Saturday, June 6th, there were 2 new cases of COVID-19, bringing Chautauqua County's confirmed total cases to 101. We crested the 100 total confirmed cases plateau. We had 24 active cases in the county, and at that point, we'd received 4,806 negative test results as of that day. That number is pretty unique, and you'll hear a new number at the end of that today, so please pay attention. On Sunday, there were no new cases to announce, but we did have 8 recoveries, bringing our total number of active cases to 16. Monday, there were 2 new cases. On Tuesday, there was 1 new case to announce. Wednesday, there was also 1 new case. And as of yesterday, we had no cases to report. I think what was interesting between Wednesday and Thursday in our data report, we had over 1,200 negative tests returned to Chautauqua County. So as you see, our testing has increased with no positives that day. Today, we do have 1 new case to announce. This is a female in her 30s. There are currently 12 active cases. That was down from 22 that we had last Friday. There are 130 individuals under quarantine or isolation orders by the Public Health Director and continue to be monitored. Again, almost half of what we had last week. And at this time, there are no individuals in the hospital in Chautauqua County with a diagnosis of COVID-19. To date, there have been 88 fully recovered cases of COVID-19. And the one number we do not like to announce, but it is reality, is we've had 6 fatalities. In total, we've had 106 total confirmed cases of COVID-19. And today, a startling number of 8,427 tests returned negative to Chautauqua County, up almost 4,000 from last week. This past week, we also saw a number of changes to items to allow to open or to resume under Phase 2. After much persistence, garage sales were announced by Lieutenant Governor just a few days ago, as the information came right across her desk during our control room meeting. They are now allowed to occur, so this beautiful weather, I'm sure our garage sailors will be much happier and again out about in the community. We'd like to remind everybody limiting the number of people inside an enclosed or confined space to only 10 at a time. Individuals must also follow all proper social distancing guidelines, wearing face coverings when closer than 6 feet to another person, and when encouraged, good hygiene practices such as hand sanitizer should be available. We also received new guidance on other items such as childcare, day camps, and pools. With each change, county offices continue to help spread the word, filter the information out to appropriate providers and businesses. It was also announced that certain personnel services had been added to Phase 3. Now Phase 3 includes the following: restaurants and food service for indoor dining, personal services including nail salons, tanning salons, tattoo parlors and piercing facilities, massage therapies, spas, and waxing and other cosmetology services. The Western New York Control Room continues to monitor the metrics daily, and it is looking positive to move into Phase 3 reopening on schedule early next week. We eagerly await official word from the governor's office as to how quickly we can move, and we would like to thank Governor Kathy Hochul for her visit this morning, to Chautauqua County and several businesses here in Jamestown. We stopped at a number of local businesses in downtown with city officials, and it was great to hear business owners discuss how things are going for their progress in reopening and giving them the opportunity to provide the Lieutenant Governor with feedback. You know, I'm taking great pride in the work we've done and all those who sit on the Western New York Control Room with me, including Mayor Eddie Sundquist. There was a delay or a change in our time today, and that was due to a control room meeting that was held statewide with Governor Cuomo, Jim Malatras, and Dr. Zucker. At that time, it was announced New York State is now the lowest in prevalence of transmission in the United States, which I find remarkable since not too long ago, and we were, in fact, the epicenter of the COVID-19 virus here in the United States. So hats off to all New Yorkers, especially those in Western New York and more so here in Chautauqua County. The latest data that we put through was a 1.3% positive test result from all of our testing. So I think we know our numbers have been low in prevalence, and I applaud everyone. But we're not out of the woods yet. This isn't over. We need to remind everybody that even as we move into Phase 3 and into Phase 4, the face covering when we're in public or when you're unable to socially distance those 6 feet has been huge. We've also been able to avoid any influx into our nursing homes. Again, there have been positive cases of employees, but I think what is really important is the masks and the PPE that our nursing home employees are wearing for our residents in nursing homes. So again, continuing to wear that PPE, socially distance yourself, and do what's right and proper. We are asking in the control room for our residents to be able to receive visitors. Those metrics are being looked at daily. I know we asked those questions, and the governor is considering that, but even the governor said he has not seen his own mother in over 100 days. So this is affecting everyone, including the governor. So we're continuing to work for the residents of Chautauqua County. I can tell you the questions you have will be brought to the control room. Governor Hochul knows my voice and knows my passion of our area residents and businesses, and that will not stop. We have been asking for gyms and fitness centers that will continue to open. We did ask for pools and public pools have been opened with guidance, as well as local playgrounds. So again, we're going to continue our efforts. At this time, I'd like to turn the microphone over to Public Health Director Christine Schuyler.
Thank you, County Executive Wendell. As the county executive had just discussed, we have seen a large increase in the number of county residents being tested for COVID-19. We really are attributing that to the increased testing requirements that are out there. And in addition to our long-term care facilities staff, that also includes those who are going for any pre-op procedure, any elective surgeries, many of those who are hospitalized in general. And we have some other professions that have recently been required to undergo COVID-19 testing. So I think that was why you see such a large jump in our numbers. The New York State Department of Health also came in and has been testing some nursing home residents as well. And as the county executive said, I think our long-term care facilities should really be commended for their infection control practices throughout this. The lack of infection control practices was a huge detriment to the New York City area. And I think we have done a much better job in our county and the administrators of our local facilities and the dedication and commitment of the staff. There are about 2,500 people who work in long-term care facilities in Chautauqua County alone. And out of that, about 2,500, less than 10 have tested positive for COVID-19 during this testing time. And so far, no residents have tested positive. I think that is a true testament to the importance of PPE. It shows that how if you wear a mask and you wash your hands, and in that case you wear gloves and some added precautions when you're directly caring for residents, you really can prevent the spread of disease. And I'm very hopeful that those infection control practices will also be a sign as hopefully visitors will soon be able to come back in and visit with their family again in long-term care facilities. Staff come and go daily. They do have lives on the outside, even though, they're encouraged to obviously follow by all the recommendations that are out there. This demonstrates that infection control practices, washing your hands, wearing a mask, wearing gloves as appropriate, and keeping that social distance actually really does work to help prevent the spread of disease, and especially in this case to those who are most vulnerable to the complications of COVID-19. So that's all I have for today, and I think it's nice that on this note that we have Dr. Spanos with us today.
Yep. So now to turn the microphone over with a slight introduction, the group that we have been concerned about the most. I've said this before, the greatest generation has lived through a lot of things, and we have done our best to try to protect that generation as we move forward. I pass a billboard every day on my way to work that says, "Your hero took care of you, now it's time for you to take care of them." So I think that is a very resounding message we've had here in Chautauqua County. So to speak to our residents today, for the Office from the Aging, Dr. Mary Ann Spanos.
Thank you, Executive Wendell. I'm glad to be here with both of you this afternoon and talk directly to the public and the seniors. I think as we start opening up, my biggest concern is that seniors have not gotten any specific direction about what they should be doing. And so some of them are thinking that because businesses are opening up, we can just resume what we always did. And we have to keep in mind that people over the age of 60 and those in their 70s and 80s are the most at risk from dying from COVID-19. In fact, there have been 24,000 deaths across New York. We've been fortunate to only have 6. 85% of those, or over 20,000 people, were over the age of 60. So there's a lot of reasons why that is. But the fact is that older people are more at risk for dying or severe complications to COVID-19. And until we have a vaccination or some specific treatment for the disease that can stop this virus in its tracks, seniors need to take care. Now, that being said, the best course of action would be to socially distance until that happened. But we know that being isolated in your own home without anyone to talk to has its own set of challenges and also detriment to your physical and mental well-being. People who are socially isolated do have worse health outcomes. And so I got together with Christine Schuyler earlier this week, and we put together some guidelines for older adults. There has been no specific guidelines from the state. These are just recommendations to help people really think about what they're doing if they're going to start to go out and get together with their friends. So we thought in June they could start with kind of a phase 1 for older adults would be to get together outside in small groups, 5 to 6 people, wearing masks. We don't recommend indoor activities. Certainly the best practice is still to remain isolated at home, but without, this generation also doesn't have access to a lot of technology. They're not Zooming like we are, so they're not seeing their friends. And that's really important to their mental well-being. So 5 or 6 people doing activities that are maybe having coffee and talking, need to wear your masks, need to stay 6 to 8 feet apart. Meeting outside is better than inside. You don't have to worry about, bring your own chair. You don't have to sanitize items. If you are going inside, you need to make sure that things are sanitized before and after use. So we really don't recommend that at this time. High-touch activities such as cards and bingo and puzzles in a group is not recommended at this time. In fact, it wouldn't be till we're not recommending that till later in August and early fall. So phase 1 in June, small groups could get together outside using their masks, using social distancing, sanitizing, just kind of visiting. Maybe there's other activities they can do, but not things where they're exchanging items, no handshakes or hugging. It's really important to limit the number of people you're in contact with. In phase 2, July, we think that they could start to get together in groups of 10 to 15. You could have exercise, again, small group exercise, keeping socially distant, and sanitizing if there's any equipment before and after use. As much outside activities as possible. Inside, where there's not as much air circulation, is, more risk. Again, the best scenario is to stay socially isolated as much as possible, but these are the safer ways to do that. And then later in August in the fall, we can see, getting together groups of 15 to 20 people. But again, we wouldn't be having any big group activities like the senior picnic that has been canceled for this year. We would not be having any high-touch activities, like we would not recommend, I should say, bingo, things where multiple people are touching multiple things and can transmit this virus. Adult daycare remains closed. I also want to echo my thanks to our long-term care facilities. I worked in most of them, and it is a testament to them that no resident has come down with COVID-19. I know that people are hurting because they can't visit their relatives, but at this time, it's not recommended, because those viruses, once they get into one of those homes, can just whip through this population, as we've seen. So we are working with the adult daycare to try to come up with some guidelines once they are given the go-ahead to reopen, but it probably will be smaller groups of people, even in those programs. So I think that's all I have to update you on today. I just want to tell people next Friday we've been given 15,000 masks by the state of New York. They're made by the Hanes Company. They are all cotton, very breathable. They also have copper and silver threads that make them a little antimicrobial. They can be washed and reused, and we are giving these out to seniors. We're going to have a drive-by distribution next Friday from 10 to 12 at all of our offices. We also have little bottles of sanitizer that we can give out, and we've made up a little booklet specific for seniors about what resources are available. Again, we know that there's websites out there, but seniors aren't as apt to go to the web for information, so we have made up these booklets that we can distribute to people, and we'll have them available at that drive-by distribution.
Excellent. All right, thank you very much.
You're welcome.
And again, the most important group that we're facing right now as far as protecting, and those are our seniors. At this time, we're going to go ahead and open the press conference up for media questions. We'll allow a limit of 3 questions. And at the end, if there's time, we'll allow for follow-up. So we'll start off with Mr. Dennis Phillips from the Post-Journal.
Thank you, Speaker. I was wondering, during the statewide control room meeting today that you talked about, what was another main area of focus, discussion was focused on?
Primarily what it was focused on was the low prevalence here in New York State, that we are now the lowest transmission, the lowest state of transmission, and have the lowest rate of transmission in the United States. So the governor was focused on that, and all the metrics we're looking at for hospitalizations, transmission, the dashboards that we look at on a daily basis, and keeping all of these things in mind, and really applauding everyone for the work that they've done, but reminding everyone we're not done yet. We still have work to do with our social distancing, and the emphasis was on states that have opened up without a phased, or even states that opened with phased approaches, that they did see a spike in those cases. So we know we will see a spike. That's something that's inevitable. But the idea is that early detection, the testing, and getting to your healthcare providers to get that initial treatment. The treatment has changed. Actually, we've realized that early treatment gives a much better success rate during this disease. So, again, the governor was applauding all New Yorkers for all the work they've done, the counties and the control rooms. So it was a good meeting, very informative, and we just like to keep up the hard work.
PJ, you mentioned something about possibility of opening up visitation rights. Would that be people from like other states, or just people being able to visit their neighbors more? If you could talk a little bit more about that.
Well, what we're looking at is the ability for individuals to visit relatives in nursing home or long-term care facilities. We know this is an ongoing concern, and it's been documented that, that interactivity between loved ones and, a friendly or healthy environment is really critical to our seniors, especially those in those long care facilities. So, the questions have been asked, can we open this up for people to visit their relatives? But again, being this most vulnerable population, we want to make sure that if that does happen, that there are metrics in place, there are systems in place and guidelines in place to make sure we continue to protect those individuals.
Thank you, PJ.
Moving on, Media One, Terry Frank.
Yes, good afternoon, folks. I wanted to direct a question to Mary Ann with regards, I know that it's kind of up in the air, but my dad has been talking with a couple of people he goes to Chautauqua Adult Day Services with in Jamestown, and I know that there are some things that are being worked out. I would imagine that, talking about games, activities, even having lunch are all on the table right now. Can you be a little bit more specific on where things are right now?
So we haven't gotten the the adult daycare. There's been a few people at the daycare, as you know, that have been working throughout this crisis. They haven't been seeing people at, the facilities are closed, but they've been contacting them daily, making sure their needs are met. And so we've been talking about, what would opening up look like. It would probably have to be very small groups when we get the go-ahead. But we've also been talking about sending some of their staff into people's homes, much like a home care worker, and loading them up with maybe a tablet and teaching them how to use that tablet to connect to maybe live streaming at the adult daycare. We might drop off activity packets for them so they could do art. They could do it in a class over Zoom. So we're really exploring how can we keep them socially distant, how can we keep them safe and still engage them. So we're looking for ideas. I've been in touch with our national association as well as Best Buy Health to see what the technology is already being used out there and what ways. But we haven't gotten the green light to go, but we're doing all the prep work, so we hope it won't be too much longer.
All right. Well, that'll be happy here. And he's enjoyed the robot cat, so thanks for that.
We've gotten a lot. We have put robo cats and dogs in about 15. How many? We had 15 cats and 10 dogs, I think, in different homes, and they're comfort cat or comfort dog, and it's really made people feel a lot better. They act like a real pet. Purr, roll over, bark at you, and just get them interacting a little bit. So it's been helpful for a bunch of people. So I'm glad he's enjoying it.
All right. Excellent. Thanks, folks. That's it for me.
All right, thank you. And here with us this afternoon, Justin Gould from Western New York News Now.
Hi, good afternoon. I do have a question for Dr. Spanos as well. In regards to maybe some grandchildren and children of the elderly in the community, when or do we get guidance on them visiting some of their older relatives, maybe ones who aren't in nursing homes? And what should that look like? I'd imagine mass, just like if there were groups of people gathering in the community now.
Right. So I think, it depends on the age of the children. Certainly, if the family can set the older adult up with technology. I know for Easter, we set my mom up with Zoom so that she could, and we Zoomed during our Easter meal. That's ideal. I've seen my neighbors have dinners on the driveway where mom and dad come and are in their own chairs, 6 to 8 feet away from each other. Everybody's, when they're not eating, masked. So there are ways to get together. You just have to make it as safe as possible.
Well, I think a lot of it's just a common sense approach.
Right.
When you bring a newborn baby home, people need to stay away from that newborn baby because it doesn't have any immunity yet. This are vulnerable elderly. So when you are going to be near someone, a loved one of yours, or visiting grandparents or great-grandparents, then you just need to keep that in the back of your mind that even though these kids can be running around and playing as healthy as could be, if they are asymptomatic carriers of something, such as COVID-19, that elderly person can get really sick. So just kind of try to keep some distance there and not smother people with kisses and hugs. And masks, are recommended. But we are living in the real world here, and I don't want people to not have any contact with the family members that they need to have contact with, but they really need to be smart about it.
Limiting your circles as much as possible. If you are just interacting with those few people in your family and they're being safe about where they're going, that can really help limit, your exposure to this virus.
I think something that we have seen, actually even here locally, but it's been seen nationally, the larger outbreaks that were very sad have a lot of times have happened in a multi-generational home where you have multi-generations of people living together, people going to work, coming back in, or going shopping, coming back in, and people within that home getting sick. And I remember reading of a family, I think it was down in Alabama, maybe, Georgia, one of those areas. And there were, I think, 8 people living in the home. 5 got sick and 4 of them died, I believe. I mean, it was a significant amount, but it really showed what happens when someone gets sick and you have older folks living within your home with you. And that was something that we've been worried about all along with our snowbirds coming back home. So it's just, we're here now. This is where it is. We have a low prevalence of disease, but that doesn't mean that we have no disease. The closer people are to each other, the more people are traveling all around and coming back and interacting, the more disease we're going to see. So we need to be smart and limit the impacts of that as much as we possibly can.
That first case in New York also really shows how this disease can happen. The gentleman came from Europe. He went to his synagogue. He interacted with a lot of people there who got sick in Westchester, took the train into New York, interacted with his firm, and those were some of the first groups. So one person, but he was interacting with so many others that he started really the epidemic in New York.
He gets the honor of being called a super spreader in the public health world.
So if we think about that and really limit the number of, interactions, I have to remind my mom all the time. She thinks I could just run to the store every day or every other day. I'm like, Mom, you need to go there once every couple weeks. Get all you need and don't go back again, because every time you go, you are coming in contact with more people.
Okay, thank you. And then most probably Director Schuyler is the best to answer this, but the negative results that we've been getting back, does that, what does that specifically tell you as a public health director here for the county? And then for maybe some people in the community who are getting excited to go, okay, we're heading in the right direction. Is that a valid look at it, seeing these negative results? Are we headed in the right direction?
I honestly think we've been very fortunate throughout this that we really have never hit any big giant spikes or anything like what was seen downstate or in more urban areas. Our prevalence rate really has not changed a whole lot throughout this. And it's very good to see so many more people being tested and coming back negative. And our prevalence rate hasn't gone up sky high with more people being sick who are now being tested, especially those who are asymptomatic. So I think that it's a good sign, but at the same time, it makes me nervous because we have no herd immunity here. The disease, it appears, really has not been here a whole lot. It's not spread around. Very few people that we've seen come through have tested positive for antibodies. So that doesn't mean that we're out of the woods or that we're not going to see another wave of this, whether it be later this summer or in the fall, sometime before we have a vaccine to really help. The more that people are out and about and traveling and gathering, the more disease we are probably going to see. People are going to be traveling in for different events and family functions, and that as we open up, and our neighbors right around us in Pennsylvania are pretty much fully opening up. There's a lot of travel back and forth there. My only recommendation to everybody, I don't care if you live in New York or Pennsylvania or Washington State, be smart. Use some common sense and keep some distance between people. Keep washing your hands. Use your mask when you're out in public and you can't stay away from people. And just be smart.
In negative results and the increase in testing across the board because of the nursing home mandate here locally? Or do you think that more people are getting tested because they want to now?
I'm assuming that because of the large numbers, a lot of those are the staff of the nursing homes who've had to be tested, as well as the residents in certain nursing homes that the state came in and did testing on. There's also a lot more professionals that are being tested, and we're getting a lot of results on people who are going in and having elective surgeries that they have been putting off for all this time. They're all having to be tested before they can have their surgical procedures done. So I think it's a combination of all of those things. I'm not seeing, I don't think there's a whole lot of people voluntarily signing up now to just, please, I feel great, but stick that swab back in my nose. So, I think a lot of it comes down to the requirements that are in place as far as pre-op testing and as well as the nursing homes and other professions. County level, we get results per person's name. We get demographic information as far as addresses and such so that we can follow up on positive results. But I can't tell you that, today I got a list of 200 people and they were all from a certain nursing home. That I can't tell you. Okay, but.
I think it's good, though, to note as well that those positive tests are one point in time. Mm-hmm. That's why they're testing the staff at the nursing homes twice a week.
No, once a week.
So
now.
Once a week, is it?
Now it just went down to once a week.
Well, that's good. But, it doesn't mean tomorrow you can't come in contact with somebody and have it. So until we, have herd immunity, till we have a vaccine and people do have antibodies, that negative test, while it's good, it's only telling you what's going on today. It's not telling you what could be happening tomorrow or the next day.
And then my final question for Executive Wendell, assuming that we are continuing to move forward and we hit Phase 3 reopening Tuesday, what is your message for the community and for the businesses who would take advantage of that?
Well, I think what's really amazing is the amount of planning that's taking place by our businesses. A lot of businesses have reached out to my office asking what they can do. We're directing them to forward.ny.gov. If you put in your NACIS number, I think it's the acronym, you put your NAICS number in there, you should be able to find out your industry and some guidelines. I know I received an email today from a local group, and forwarded it on to John Majori within a matter of minutes. I got a response back from the governor's contact that we use, and put the information in, found out that that business was able to open. So I applaud those that are reaching out, the businesses that are ready. There are some that are, I guess, chomping at the bit. They want to get going, and I'm, pushing as much as we can. The lieutenant governor was here, and she knows, health centers and fitness centers are something I've been pushing for, and she knows, that's something key for us. And I'm telling everyone that industry really needs to get their plans, and most of them have them already. Needs to be ready because they could come at any time. But, the businesses are really taking advantage of that opportunity. We're getting the lowest I've seen in the last couple of days is no fewer than 23 businesses. Some days it's as high as 54 businesses that have filed that affirmation. And what's encouraging is those businesses are looking for ways, looking at the guidelines and how are they able to open safely and effectively and meet those guidelines. And it's impressive for those people that are really ready to get going. But again, urging our residents, repeating the message we were sending today, get out, spend local, support our local businesses, restaurants, diners, retailers. That's really what's the key to all of this, is getting that local economy up and moving, getting that money circulating back around. And I'll say this and continue to say this throughout, our comeback will be far greater than our setback as we emerge from COVID-19. And the pause, we'll be able to demonstrate, just how well we come out of this and how successful we can be.
You've been really working one-on-one by the sounds of it, not just communicating, obviously, in a mass like this for the press conferences, but people reach out, you take their question, get an answer, and reach back to them. How many instances have you had like that?
I don't know, a lot. We several a day, 10 or more a day reach out to us via, whether it's calling our office, emails, my Facebook page, we monitor that. The county executive page, and just making sure we get back. That's effective government. That's effective leadership, is making sure we reach out and get those contacts. And my job is to, again, I've said this before, is the safety. And as the safety has been there throughout, protecting all of our citizens in Chautauqua County and residents, now the fiscal safety I've talked about all along. So that's the next thing we're looking at, is getting businesses back, getting them opening, finding out that how do we fit them in this niche? How do we get them to open up safely and effectively? And that's really what's important. A lot of times it's just a simple question. Maybe they didn't fill something out. They didn't think something was important, and they added that to the questionnaire. Oh, here we are. They're able to reopen. So I think that's, but it's effective. That's how I've always considered myself as a servant leader, is getting out there, making those contacts, and when people have a question, getting back to them quickly and effectively. And I can't say enough, our contacts with the governor's office have been tremendous. And, whether it's Lori Cornell, John Majori, Tim Richards, anybody we've worked with, Melissa Bichevsky from the lieutenant governor's office, they are quick to get right back to us, and very effective means of getting answers and getting things done for people in the community.
Thank you.
If no other questions, we're going to wrap up.
I'm here.
Oh.
I'm here.
Oh, Dave Rowley, I am so sorry.
Yeah, I think you guys,
Man.
I'm trying
Whoa.
to keep it to two questions,
WDOE,
which
I am
is
so
the
sorry.
format.
Well, then you can have more, Dave. I totally apologize.
Okay,
Sorry, go ahead,
that's
Dave.
okay.
Yep.
Want to hit Phase 3 a little bit, and the schedule to Phase 3. We understand the earliest you can go to Phase 3 is Tuesday?
Correct.
Okay. And will there be an announcement prior to Tuesday? There seemed to be some confusion when the state moved Western New York into Phase 2. There seemed to be kind of a delay. Will they try to avoid that this time around?
That is my hope. Yeah, we were ready today. I was a little optimistic. We had a lot of excitement about this afternoon's statewide control room. I thought maybe we'd get a little bit of a boost from the governor and maybe some bonus news, but I'm hoping that question would be raised on Monday and we would have an answer, Monday afternoon like we have in other regions. I know once, and again, I raised concern after last meeting I jogged down to get on the control room, and, my concern was that, on Tuesday, midday, the governor announced we're in, Western New York's in Phase 2, and the question is, could we get that answer sooner? I know last, Monday he said, Western New York will have an answer by the afternoon, and we never did. The following day, they said the capital region could open Wednesday. We'll get you an answer by Tuesday afternoon, and they did. So, yes, to avoid confusion, I'm hoping the governor's office does get that information so our businesses can start off the day Tuesday morning ready to go and ready to open. So those are my hopes. We'll convey that message again with our control room as we meet for the next couple of days. And that's a concern that we've all had in the control room, that indicator of when we can open officially will be there prior to the start of business on Tuesday.
Okay, sounds good. Thank you.
Any other questions? Sorry.
One follow-up question, really about the process. Are they continuing to use these global health experts to take a look at the data that has been coming in?
They are. We ourselves in Western New York rely on Dr. Kane out of the UB School of Medicine, and he is our local expert. We've asked early on, and he's been part of our group. And he, again, I've said this before, he's the third question asked, Dr. Kane, how do the numbers look? And, he's right on top of it. And those numbers have really, really trended in a positive direction. So, we're eager. The numbers are there. The metrics are being measured and reviewing every day. The big thing the governor said today was, we will see, the control room will see those changes in our metrics sooner than, the public will. So we're continually looking at those. We're going to be, monitoring our contact tracing. Again, I feel has been second to none. I'd put our group here against any other group in the state as the effectiveness. And that effectiveness of our contact tracing, I believe, is also part of the prevalence, of the low prevalence we've had of COVID-19 here in Chautauqua County.
Okay, PJ, thank you.
You got it. Thank you. So again, with all apologies to WDOE and Dave Raleigh, who's always there and a great supporter of us, we will now officially wrap up our press conference. We'd like to thank everybody for watching, streaming in live. We're not sure how many more we're going to be having as we move into Phase 3 and Phase 4. The information is starting to come